An abdominal hysterectomy is a surgical procedure that removes your uterus through an incision in your lower abdomen. A total hysterectomy removes the uterus and the cervix. Sometimes a hysterectomy includes removal of one or both ovaries, and an abdominal hysterectomy may be recommended over other types of hysterectomy if you have a large uterus. You may need a hysterectomy to treat. If you have a gynecologic cancer such as cancer of the uterus or cervix, a hysterectomy is the only certain, permanent solution for fibroids, benign uterine tumors that often cause persistent bleeding, anemia, pelvic pain, or bladder pressure. Many women with fibroids, a hysterectomy may be necessary to treat these conditions. A hysterectomy is generally very safe, but with any major surgery comes the risk of complications. Risks associated with an abdominal hysterectomy include blood clots, infection, excessive bleeding, adverse reaction to anesthesia, damage to your urinary tract, bladder, rectum, or other pelvic structures during surgery, which may require further surgical repair. Earlier onset of menopause even if the ovaries aren't removed. Rarely, death. It's normal to feel anxious about having a hysterectomy. Here's what you can do to prepare. Ask your doctor and surgeon questions. Find out whether you should change your usual medication routine in the days leading up to your hysterectomy. Discuss what type of anesthesia you'll have. Abdominal hysterectomy requires you to have general anesthesia, which makes you unconscious during surgery. During abdominal hysterectomy, your surgeon detaches your uterus from the ovaries, fallopian tubes, and upper vagina, as well as from the blood vessels and connective tissue that support it. The lower part of your uterus, cervix, is usually removed, total hysterectomy, but may sometimes be left in place, partial hysterectomy. If necessary, your surgeon may remove additional pelvic organs and tissue, such as your ovaries or fallopian tubes. Before surgery, you may have tests done to check for cancer, which could change your surgeon's approach to surgery. Tests may include cervical cytology, Pap test, which detects the presence of abnormal cervical cells or cervical cancer. Endometrial biopsy, which detects abnormal cells in the uterine lining or endometrial cancer. Pelvic ultrasound, which may show the size of uterine fibroids, endometrial polyps, or ovarian cysts. The day before and morning of your surgery, you will be instructed to shower using soap provided by your surgeon to reduce your risk of infection. A preoperative cleansing of your vagina, vaginal douche, or preoperative cleansing of your rectum, enema, also may be done. Immediately before surgery, you'll receive an intravenous antibiotic medication to minimize your risk of infection after the procedure. A hysterectomy typically is performed under general anesthesia, so you won't be awake during the surgery. The procedure itself generally lasts about 1 to 2 hours, although you'll spend some time beforehand getting ready to go into the operating room. To begin the procedure, a member of your surgical team passes a urinary catheter through your urethra to empty your bladder. The catheter remains in place during surgery and for a short time afterward. Your abdomen and vagina are cleaned with a sterile solution before surgery. To perform the hysterectomy, your surgeon makes a cut, incision, in your lower abdomen using one of two approaches. A vertical incision, which starts in the middle of your abdomen and extends from just below your navel to just above your pubic bone. A horizontal bikini line incision, which lies about an inch above your pubic bone. The type of incision depends on many factors, including the reason for your hysterectomy, the need to explore the upper abdomen, the size of your uterus, and the presence of any scars from prior abdominal surgeries. For instance, hysterectomies performed for endometriosis, large fibroids, and gynecologic cancers are done mainly through a vertical incision. After surgery, you'll remain in the recovery room for a few hours. Your healthcare team will monitor you for signs of pain, give you medicine for pain and to prevent infection, encourage you to get up and walk around soon after surgery. An abdominal hysterectomy usually requires a hospital stay of 1 to 2 days, but it could be longer. You'll need to use sanitary pads for vaginal bleeding and discharge. It's normal to have bloody vaginal drainage for several days to weeks after a hysterectomy. However, let your surgeon know if you have bleeding that's as heavy as a menstrual period or bleeding that's persistent. The abdominal incision will gradually heal, but a visible scar on your abdomen will remain. It takes time to get back to your usual self after an abdominal hysterectomy, about 6 weeks for most women. During that time, get plenty of rest. Don't lift anything heavy for a full 6 weeks after the operation. Stay active after your surgery, but avoid strenuous physical activity for the first 6 weeks. Wait 6 weeks to resume sexual activity. Follow your doctor's recommendations about returning to your other normal activities. A hysterectomy permanently changes some aspects of your life. If you have a hysterectomy before menopause and you keep your ovaries, you may experience menopause at a younger than average age. Some women even experience more sexual pleasure after a hysterectomy. On the other hand, you may feel a sense of loss after hysterectomy. Thank you for watching this video. Hit the subscribe button so you can get new videos. You can read more about this on our website www.wellnessbuddy.com.